This is Wim Hof, also known as the Iceman, and you're probably wondering how he's able to swim in a frozen lake without getting hypothermia. He has defied science multiple times by being able to control his core body temperature at will, and claims that cold exposure has numerous benefits. Similarly, I'm sure you've all seen or have heard of athletes taking ice baths to reduce inflammation and injury damage. But could there be alternate benefits of cold therapy that could be used to treat patients with obesity and diabetes?
Hey, but what is actually happening during these ice baths? Well, to better understand that, we need to understand what brown adipose tissue is, right over here. Now, what can also happen is that your brown adipose tissue, known as your brown fat, can actually start burning off to increase your body temperature. Now, this is kind of like a mini furnace in your body. It can produce a lot of heat in a short amount of time to maintain your body temperature. Now, you also have to understand that our bodies are like control freaks. They try to maintain anything that's off within our body, and they have a lot of methods to do so. This is called homeostasis.
Now, the adipose tissue you're probably more familiar with is non-brown adipose tissue, which can overaccumulate leading to obesity. Obesity is linked to an increase in the risk of diabetes, cancer, and high blood pressure, as well as heart disease. Also, due to its high stigmatization, obesity can lead to poor mental health. It's like your body is a puddle of water and obesity is like a stone thrown inside. As you disrupt one area, other aspects of your life are also affected, like a ripple. Annually, 48,000 to 66,000 Canadians die from conditions linked to obesity. Current obesity treatments are limited to surgery, medications, and weight management programs. And although Canada spends $4.6 to $7.1 billion each year on such treatments, they are still underfunded, making them inaccessible to most. To provide numerous individuals with better quality of life and to reduce the toll on the healthcare system, a more practical treatment for obesity is needed.
And so, what could possibly be done to help this unfortunate situation? Well, that's what Dr. Catherine Morrison, a professor in the Department of Pediatrics at McMaster University and co-director of the Center for Metabolism, Obesity, and Diabetes Research, is researching. And here today, we have an exclusive interview with a research assistant in her lab. So everyone, please welcome Roy. So Roy, please tell us a little bit about the lab and what they're researching.
Yeah, thank you for having me, Mark. So what if I told you that fortunately, ice therapy might just be a possible treatment for obesity and diabetes. In recent studies, the Center for Metabolism, Obesity, and Diabetes Research has found strong evidence that brown adipose tissue is rapidly activated in response to cold. By analyzing the supraclavicular region, an area containing high concentrations of brown adipose tissue via MRI imaging following exposure to cold, we were able to see a significant decrease in proton density fat fraction, or essentially just fat, in the supraclavicular region after just 10 minutes of cold exposure.
Okay, that is great and all, but what does this exactly mean?
Right. So essentially, after exposing participants to cold via these cool-looking suits, they were able to increase brown adipose tissue activity, leading to fat metabolism or breakdown of the fat stored within this region. This increase in metabolism happens due to brown adipose tissue playing a very important role in non-shivering thermogenesis. This process aids in the generation of body heat through the breakdown of fat and blood glucose.
Oh, okay. I see where this is going. So what does this mean in terms of figuring out a treatment, and what can this entail for patients in the future?
Yeah, so by figuring out the potential time course of brown adipose tissue activation and the replenishment of fat storages in this area, a possible treatment routine could be developed that could maximize and aid in lowering body fat percentage in individuals suffering from obesity and diabetes. Now, while ambitious, this potential form of therapy could benefit millions of people and help create a non-invasive therapeutic alternative that would not involve surgical procedures or drug treatments. This could become part of an individual's daily life as they work towards a healthier future. There's still a lot of research to be done in this area though, but it is definitely a great step forward in the right direction. While the future of this research is unclear, only time will tell on broad ranges of possibilities that could come out of this. Now, I don't know about you guys, but the future seems bright. I might just have to follow Wim Hof's footsteps and get a step ahead of the game. How so? Well, by starting my ice cold therapy, of course.
Thank you for watching.